Good afternoon, everyone. I'm Johanu Botha, the Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. As of today, almost 1.7 million doses of vaccine have been given. Nearly 78% of people aged 12 and up have had at least one dose of vaccine, and over 63% are fully vaccinated with 2 doses, making Manitoba the most vaccinated province in the country. Manitoba also continues to lead the provinces in per capita doses administered to people aged 12 and up. I want to thank everyone who came out to last week's Vaxathon, which resulted in almost 10,000 doses being administered to individuals who did not have an appointment. We know that every dose counts, and while our super sites are still an important part of our vaccine rollout and will continue to be for the short term, we know that we need other approaches combined with some partnerships and creativity to get us where we need to be. With that in mind, I want to focus today a bit on some of the many other ways we're helping to ensure the vaccine is available and accessible to people across our province. The 5 urban Indigenous clinics located in Winnipeg, Brandon, Portage-la-Prairie, and Thompson continue to offer vaccines in trusted spaces where community members are welcomed and applauded for their decision to get the vaccine. These incredible clinics continue to ensure that culturally appropriate supports are incorporated, as well as food and refreshments, medicine bundles, children's activity kits, to name a few, are built into the process as well. Community partners support this kind of work by distributing posters and going door to door to help reach people in the neighborhood. We're continuing to bring, and we will continue to bring, vaccine to new spaces to help reduce barriers and encourage people to get their shot. In fact, we've got more than 1,000 doses available at campgrounds and provincial parks in Prairie Mountain Health in the days ahead, in places like Clear Lake, Minnedosa Beach, Nanette, and Sandy Lake. All of the walk-ins and pop-ups are posted on our website, as always, and I hope this helps you find a place close by. And while the dose numbers are smaller than what we've often talked about, they continue to make a difference. For example, a pop-up in Mississippi ran for 2.5 hours. It vaccinated almost 30 people, about half of them youth. People came from Gladstone, The Pas, and Verdun, and it was a positive experience for them to get their shot. We are also seeing the positive effect of the mobile immunization clinics that has been in operation now for about a month or so. The goal, of course, has been to increase access to the vaccine for people experiencing barriers and to bring the vaccine to neighborhoods where uptake could be low because of those barriers. To date, the mobile clinics have administered almost 2,000 vaccines in Winnipeg. Many of them, almost all of them, first doses. And our urban Indigenous and community partners deserve so much credit for initiating, helping to develop, and then ultimately helping us to implement this successful model. These mobile clinics have visited, to name a few, Lord Selkirk Park, William White, Central Park, Siloam Mission, Pritchard Playground near St. John's High School, McGregor, and the Bell Tower on Selkirk. Last week, they made stops at Manitoba housing complexes throughout the city. And this week, the mobile clinic will be in Winnipeg again, but also visiting several communities in Southern Health, Santé Sud, to help boost immunizations in that part of our province. This incredible work is being reflected in so many spaces throughout the province. And here's another example. The Health Sciences Center Emergency Department has trained their staff so they can now give the COVID vaccine to anyone who comes in for care 24/7. I don't think any of us who work outside the medical field, which includes myself outside of the task force, truly understands how busy an emergency department can be. So for them to be willing to take that extra step, build it into their process to make sure the people they're caring for during an emergency are protected against COVID once they recover and leave the hospital is exceptional work, and we hope to continue to see that across our system. This too will help ensure people who might not otherwise be immunized have that opportunity, that chance, if they happen to be in the emergency department at HSC. We are also continuing to accept applications for the Protect MB community outreach and incentive grants. Funds are available to organizations, businesses, schools, and other groups with a connection to community, especially with lower vaccine uptake. So far, we've funded more than 40 organizations, and we want our group to be a part of this work and your group to be a part of this work going forward. More information is online at protectmb.ca. As I've talked about before, the vaccine is here in enough supply that we have a dose for everyone who wants one. So it's up to you, it's up to all of us. The next provincial vaccination targets are set for Labor Day, to be met before Labor Day, for 80% of Manitobans to have at least one dose, and 75% to be fully vaccinated with 2 doses. What that means in real numbers, what is the task ahead for us? Well, we need about 25,000 people to get that first dose, and 13,000 of those already have appointments, so we know they're locked in, they will occur. So we just need 12,000 more net new, if you will, Manitobans to roll down their sleeves, and we will hit that target of 80% 12 plus Manitobans getting 1 dose. And while we need nearly 140,000 people to get their second dose to hit the second dose target, about 80,000 of those already in the system, already have an appointment, so those are sort of baked in, they will occur. So we just need 60,000 more Manitobans to show up for their second dose, and we will hit that target as well. We believe this target is absolutely achievable. It's within reach. It could be in reach quite soon, as long as we all show up and roll up our sleeves. And I think with that, I'll pass it over to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Reimer, Medical Lead for the Vaccine Implementation Task Force. As Johanu has spoken about before, we are now in a place where we have enough vaccine supply to meet demand. So from a clinical perspective, that means that now is a good time to revisit our direction on which vaccine you should get for your second shot. When we were going through vaccine supply disruptions and delays and uncertainty, it was important for you to know that having a mixed schedule was safe, effective, and recommended at that time. Our priority was ensuring that people were getting protection from the second dose. Now, you can book an appointment or find a walk-in opportunity for Pfizer or Moderna, generally within a few days of each other. So the guidance for you is to get the same brand of vaccine for your second dose whenever possible. We still don't want you to delay your second dose. So if that means a mixed schedule for whatever reason, this is still a safe and appropriate choice. I also want to highlight an important date that's coming up soon and what it means for Manitoba parents and caregivers. While we're in the midst of summer now, it is never too early to plan for back to school. For your child to be fully vaccinated for back to school, so that there's 2 weeks after their second dose, they need to get their first shot by next Tuesday, July 27th. That allows for the minimum 28 days between doses and the 2 weeks following the second dose. There are Pfizer appointments available for young people aged 12 to 17, so it is a good time to add this to your summer calendar. Today, I also want to take this opportunity to speak about some of the more common questions and concerns that I'm hearing from Manitobans. The first question really touches on why you should be vaccinated in the first place. If you're young and relatively healthy, you may think that you don't need to be immunized, or that you're strong enough to fight off a COVID infection on your own. The simple fact is that if you do get COVID, we cannot predict how sick you're going to get. It is true, generally speaking, that the most serious illnesses and risks were seen more often in our oldest population. And that's why we took the approach we did when vaccine supplies were so limited early in the campaign. But the situation is changing. We've seen the rise of COVID variants. These variants are more contagious and often have more serious implications for your health. Like you, I have read the stories about young, healthy people in their 20s, 30s, and 40s who have been in the ICU. we're also still learning about the long-term effects of COVID in people, even in those who may not have had a serious illness initially. Nous avons été témoins de la montée des variants plus contagieux qui ont des conséquences plus graves sur la santé. Comme vous, j'ai lu des récits des personnes jeunes en bonne santé dans la vingtaine, trentaine et la quarantaine qui ont été admises aux soins intensifs. Nous apprenons encore de nouvelles choses sur les effets à long terme de la COVID, qui se font parfois même sentir chez des gens qui n'avaient pas été gravement malades. And even if you don't get seriously sick, you can pass it on to the people that you're with, who will then pass it on to others, and them to others. So there is one way to stop this chain, and that is to get your vaccine, because you don't need to face the risk of COVID-19. This next question has come from people who have already gotten their first dose of vaccine but are a little concerned about the second. Many people have heard that the second dose of vaccine packs more of a punch than the first in regards to side effects. These side effects, while mild and manageable, can be more significant than they experienced after the first dose. It's not true for everyone. Speaking for myself, I only experienced a sore arm. But it is possible that this can occur, and that's backed by more than just anecdotal evidence. Clinical trials have found that there are slightly higher rates of side effects after the second dose. That's likely because the second dose is triggering a stronger immune response in your body. So that means the vaccine is doing exactly what we want it to do. Les essais cliniques ont montré que si les effets secondaires sont un peu plus prononcés après la deuxième dose, c'est parce que celle-ci déclenche une réponse immunitaire plus forte dans l'organisme. Ça signifie que le vaccin fait exactement ce que nous voulons qu'il fasse. These side effects are still typically mild, sore arms, fever, fatigue, and can usually be managed well by taking over-the-counter pain relievers, staying hydrated, and even just moving your arm after you receive your shot. There are a lot of options available to people now, so you can choose when and where you get your vaccine. And while not everyone has this privilege, if you can, try to build in some time for your body to rest and recuperate after your dose. So that brings me to the third question that's coming up more frequently. You may have heard that Pfizer has approached the US government to get approval for using its vaccine as a third booster dose. Naturally, people want to know if we will all need a booster shot. The short answer is that it's still too early to know for sure. There are at least two different scenarios where we might need to have a third dose. The first is a scenario where it's truly a booster shot, and that's because we would see that immune responses wane over time. So far, we're seeing a very minor dip in effectiveness in the COVID vaccines over time. But overall, the efficacy has remained about 90% after 6 months, which is still an excellent immune response. But with 90% efficacy, we are satisfied that we don't yet need to have a booster. This is something that experts are studying around the world, and something we are also monitoring closely. It is possible over time that we will need to plan for a booster shot to rebuild our immunity. This might need to be done sooner for people who are immunocompromised. Their decreased immune response means that they have lower antibody levels to begin with, and we have less certainty around their ability to mount a good immune response. But we don't yet have data telling us whether or not the lower antibody levels truly translate into lower protection. And so we're still waiting on further information, even for those who are immunocompromised, about a third dose. The other situation where we might need a third dose is a little bit different. So instead of being about our immune response overall, this situation depends on the virus itself. The longer that the virus mutates and spreads among non-immunized people, the more likely it is that we could see other variants of concern. So it's possible that in the future, there could be a variant of COVID-19 where the current vaccines are less effective. So this could mean we'd need another vaccine to provide better protection against that strain of the virus. To date, we seem to have good protection against all of the existing variants of concern from the vaccines we're using right now. So that's really important to keep in mind. But with that in mind, Canada's National Advisory Committee on Immunization and the American equivalent, ACIP, are still not recommending a third dose for these variants. I will keep you updated on booster shots, on third doses, including if and when we might need them. It's possible that this vaccine could become a regular part of life after COVID for all of us, and we will follow what the science and the evidence shows us. Before we go to questions, there is one topic that I wanted to speak to, and that's medical exemptions for immunization cards. Right now, the requirements related to being fully vaccinated in certain settings are outlined in the public health orders. We do get asked what happens if someone can't get immunized for medical reasons, and whether they should be excluded from those activities that others who have been fully vaccinated are now able to do. I want to be very clear that there are very few people who shouldn't be vaccinated for health reasons. We've reached out, for example, to the allergy clinic and determined that no one in Manitoba has been told that they absolutely can't be immunized due to fears of an allergic reaction. There are other conditions, though, that we need to keep in mind. Fortunately, we have several vaccine options available to us, and different vaccines might work differently for people based on their medical history. So this is an important topic, and while we don't expect that these public health orders will be in place forever, we are continuing to work with specialists to get a better understanding of how many people this may affect and what further steps we may need to take. With that, we will go to questions.
Thank you, Doctor. Up first from the Brandon Sun, Kimberly.
Good afternoon. This question is for Mr. Botha. Mr. Botha, I took a look at the vaccines that are being administered by the province, and there's a noticeable decline in the beginning of August. And I'm just wondering what is the cause behind that large drop in daily administered doses? And maybe you have a comment on that.
For sure. Thanks, Kim. So if you look at our current forecast, you see that sort of big spike at the end of July, where there'll be some days where we anticipate between 15 and 25,000 doses to be administered. This largely reflects a number of individuals who are getting their second doses, notably with Pfizer, given the amount of Pfizer that's coming into the system shortly. And then after that time, the amount of appointments have really leveled off, because we should at that time, you know, if all goes well, be very close to our targets. The doses that sort of dropped off in the first 2 weeks or so of August, that's a baseline. That's the floor. That's sort of the minimum that we'll get, because it's based on the appointments largely that we see at super sites. Anything that'll still occur through community-hosted clinics, pop-ups that haven't been scheduled or planned yet, certainly through our pharmacists and physician partners, are not captured in that projection. So it's no reason to be very pessimistic. It just means that we're at that point where the super sites have done a lot of heavy lifting. The appointments will probably be running out around that sort of middle end of August, and hence why those projections are low. But it doesn't mean that we have to be stuck on those. They could certainly be higher if demand increases. And again, they don't capture any of the non-appointment channels. It reflects a leveling off of demand as much as it reflects the fact that we've moved through so much of the population, where we're not doing the large numbers that we used to see over the last few weeks, and we will see over the next couple of weeks.
Okay, thanks. Clarifies that. So this next question is directly tied into that. So Keystone Super Site is closed from August the 1st to the 3rd, and we're being told that it's been going on for a few weeks. I'm just wondering if any other super sites are going to be closed and why, and then how does this impact the province's goal of reaching 80% first dose and 75% second dose by September long weekend?
So it won't impact us meeting those targets at all. We run the hours and the days for as much as there is demand. So if there are days where there really hasn't been any appointments made for those specific days, we're not going to run a massive large site that can do between 10 to 15 in the case of RBC, or 15,000 a day. We are at a point where these super sites can have operate only a few days a week or regular hours. About a week ago, we were doing 7 days a week, 7 to 11, and these super sites were not filling up where we needed to use all those hours. Hence why we're continuing to emphasize these accessibility-based approaches, but we'll keep them running as much as we need to, and we will never have the super sites be the reason that we don't get to our targets as fast as possible. If appointments open up again, or if there's a demand that requires it, those are pipes we can open up. We can extend those hours, we can open those days, but we don't want staff just necessarily sitting around either. We do have a workforce to respect and to manage, so that's part of what goes into that kind of thinking. But we can open up on a dime if we need to.
Moving now to CJOB and Anya.
Good afternoon. As vaccines eventually slow down, when do you guys anticipate the consideration of closing any of the super sites?
So we're working through the sort of final phases of that plan, that phase out plan, or I should really sort of say the VITF sort of 2.0 type plan. We want to ensure that above all else, the clinical side has all the tools at their disposal that they might need. As we get to mid-August, end of August, it's very likely that these big pipes, these big super sites may not be necessary beyond that time frame, at least maybe not all of them. Because of demand, but because also we don't, the population is getting vaccinated fast, and these super sites can do thousands a day. So what we're really looking at, like other jurisdictions are, over August, certainly September, October, at what point does it make sense for us to phase out a super site per region? What would that look like? But ensuring that we still keep, the ability to run a pop-up, keep our distributed channel partners flush with vaccine. Our focused immunization teams aren't going anywhere, so if we need to provide the clinical team with those in any kind of context, they'll be available. And of course, our community-hosted clinics can still apply for grants. So I think what we'll see is a phasing out at some point, mid-end August or beyond of these larger sites, while keeping the other tools in the toolkit. But I think, as we've said before, we're still in the fight. So while we are finalizing the plan, we're not going to pull the plug on any of these, at the moment, or confirm that we will, until we sort of know that we've done everything we can to provide as much opportunity for all Manitobans to be vaccinated. So if you do a high-level jurisdictional scan, you sort of see our provincial partners across the country think about phasing out some of their larger pipes, mid-August, end of August, and beyond. And we've got those plans in place. We just want to sort of nail down the exact dates as we keep watching the behavior, and there'll be more to come. The moment we have something concrete and we feel comfortable that we can put dates to this, we will share with Manitobans. But at the moment, we're still in the race to get vaccinated.
Okay, great. And can you tell us of any new kind of creative strategies like the campsite pop-ups that you might have planned going forward?
So there's quite a bit. The campsite one is one, as you mentioned. Our community-hosted clinics continue. So we've allocated now over 30,000 doses to them this week. I should get the exact figure, but I think it's between 25 and 30 that are running this week. Of course, we don't advertise those community-hosted clinics widely unless we were asked to by the community partner, because it is targeted to a very specific community, often for dose ones. There's a lot running. They're either supported by one of our focused immunization teams or often with a distributed media channel partner, and those will continue. And they're quite diverse. They're all across the province. That's probably where we will continue to see this kind of creativity occur, is through community-hosted clinics where community partners come to us, provide an idea, and then we support them as much as possible. Although, as you've mentioned, our regional health authorities themselves are being quite creative as well by taking the vaccine out, like campgrounds. There's lots of ideas that we can implement to ensure that lack of convenience is not a barrier. So we're looking at those pieces too. But community-hosted clinics is probably the main strategy going forward.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. You've been asked before, but I got to ask again, seeing as we continue to see some concerns about, a lot of concerns about the spread of Delta among unvaccinated people, the spread generally among unvaccinated people. What is the continuing rationale in not switching the 12 and up appointments to allow youth who have their birthdays turning 12 this year to get it, as BC has?
So we followed Health Canada's approval. Health Canada and the studies themselves looked at people who were 12 and over. And so that's what Manitoba followed. There's not currently Health Canada approval to go below age 12. And so I can't speak to the logistics or decision making for other provinces, but our decision was based on the evidence that we had, as well as the approval from Health Canada. We look forward to expanding access to more age groups once the companies have completed their trials in younger children, and Health Canada has had a chance to review and approve those, and we'll certainly move that direction as soon as we get the okay from Health Canada to do that.
Dr. Reimer, we continue to see very slow movement in a couple of the southern health districts. Stanley has been at 20.3% for a couple of days, first doses. Winkler sitting at 36%, 36.5%. Can you please provide an update on how your efforts at community-led outreach and clinics are working on these low vaccination areas that are still, quite at risk of future outbreaks?
Yeah, we're obviously very concerned about low numbers in certain health districts because we don't want to see outbreaks. We don't want to see anyone else end up in the hospital or the ICU or dying from this virus, and that's why we're working so hard to reach as many people as we can. And Southern Health has done a lot of really great work. I know they've reached out to over 30 churches to connect with them directly. They've reached out to a large number of employers. Any employers that have large workforces, they reached out and ran a day that was specifically for those employers at some of their vaccine sites. So that work that they've done has been impressive and helpful, but we still need to do more. We know that there remain people in Southern Health, as well as the rest of the province, who still have questions and concerns. And so this is going to take a long time. We're not going to see a big jump in some of these areas, but we do plan to continue working with them for the foreseeable future to help them feel more confident in this vaccine as the best protection available for them. And our team at the provincial level, as well as Southern Health, plans to continue engaging with things like town halls, with local leaders, with some of the community organizations, the physicians, the pharmacists, as we go forward.
From CTV, Michelle.
Hi. We're learning today that there's several thousand immunization records that aren't addressed. I'm just wondering, was this a human error or was it a data error, computer error? Do we know why some weren't recorded properly?
So yeah, I could take that one. I think it's more so than an error. It's just the scope and the size of what we're doing in terms of getting data from individuals and then entering that data into a system and then maintaining that data and then ensuring that the data goes out into a Vax card. We have had 740,000 or so Manitobans now with 2 doses. Of that 740,000, we've had about 30,000 queries. Half of them have been resolved. The other half have many duplicates and often are more questions than they require some kind of correction. Now, the individuals who are waiting to have data corrected, we can understand how frustrating that is. And that's why we have a large team working through this. And we will continue to work through it. But in terms of the scope of the problem, it's between 1% and 2% of all data that's entered in an immunization campaign that's larger than anyone we've ever done. So the problem is acute for the individuals experiencing it, and we feel that, and we don't want the individual to go through that frustration, and we will continue to work through it. But in terms of it being a systematic issue, I wouldn't call a 1% to 2% issue a systematic issue. I think there's a couple of things going on as well. There's the immunization data that we enter at the site. We're working through correcting that. I think a lot of individuals are also calling in to correct their health card information because the health card information now is tied to be able to order the Vax card. So there's that correction going on. And then many individuals are calling in when they don't have a Manitoba health card and they'd like the Vax card. And at this point, government is still working through how to technically make that possible. So there's sort of 3 buckets that government is working through. The task force is really focused on ensuring the data entered at the site is correct. And then there's those other pieces. We're actively working through all of them, and we will continue to do so. So we feel the frustration, but we will continue to work through it and get people their data corrected and so they can apply for their Vax card.
Okay, thanks. I'm just looking at the report from this morning. Next week, it looks like we're going to jump several, like about 30,000, 40,000 doses. Is that just a lot of second doses that are in those numbers, or what's with that big jump next week?
That's correct. It's largely second doses, but there are individuals who have made appointments for first doses for Pfizer because for a good while there Pfizer wasn't available for youth or even for adults if all the appointments were filled up. So we will be awash in Pfizer shortly. So it reflects that in part, that there's appointments booked for Pfizer and then a large number of individuals waiting for their second dose of Pfizer throughout the rest of the month, which is also partly what gives us the confidence about meeting our 2 targets.
From the Winnipeg Free Press, Danielle.
Good afternoon. Johanu, can you confirm that come early August, the Winnipeg super sites will not be open 7 days a week?
No, I don't think we can confirm that yet. We'll adjust our hours based on demand and what makes sense for our workforce. At the end of the day, we want to make sure that we are not a barrier to how fast we get to those targets. So the hours will certainly adjust, and the days that they're open will certainly adjust based on demand. But I don't think I'd lock us into a particular hour or day schedule at the moment. I think, for a city the size of Winnipeg, at the very least, we would want 7-day coverage of a super site running. But we'll lock that in and communicate it out as we sort of see the booking behavior over the next week or so.
So how significant do you anticipate that scale back might be? For example, eventually do you think you might go to maybe 7 days at one site, 3 days at another, or just 8-hour days instead of 12? What do you think that difference may be?
So once we land on something concrete, we'll certainly share it with Manitobans. But I mean, the model that you're suggesting, Anel, is something that we certainly thought about, and it's one of the plans that we could pivot to. It's, do we have shorter hours with both sites? Do we have longer hours, and then sort of run them separately so that we still have coverage across the week? They're all on the table. The nice thing is these are our sites for now. They are part of our operations, so we can turn them on and adjust as need be. We don't want idle sites, and we don't want a workforce that doesn't feel like it's being used well. So we really want to find that balance. But we'll turn it on and off as we think we need to for the demand. But once we have something concrete, as always, we'll blast it out and share with Manitobans.
Our final reporter today from Global, Brittany.
Hi, good afternoon. You guys started doing the immunizations at beaches and parks last week, and I'm just wondering how that first weekend went, how many shots were given out, and why we think that that is one of the best strategies to use for these community outreaches.
So it's one strategy amongst many. We found that convenience can be a factor for some individuals. So ensuring that it's at their workplace, as we've often done with a distributed channel partner, or ensuring that it's at one of our many parks for individuals who might have had the first dose but now is off camping or is able to take a break. That the option is there too. So we don't lose the vacationers, so to speak. It's one tool amongst many. It went very well by all accounts. I don't have the numbers specifically on the doses administered, but we do aim to allocate more and to have it occur in parks outside of the Prairie Mountain region as well.
Thank you. We've gotten some complaints from a number of people who eventually are looking to travel that cruise ships are not going to be accepting anybody who got a mixed vaccination plan, like many people here in Manitoba did. What are people who had that mixed vax dosage expected to do now to be able to comply with some of these rules that cruise ships, and we've seen Broadway previously had put this out as well?
I can take that one. So I've certainly heard concerns about travel to the U.S. Right now, the U.S. doesn't have any vaccination requirements for entry. They recommend a 2-week quarantine if you're not fully vaccinated, but don't have that as an enforced requirement. Although there are certainly still rules about what reason you can use to cross the border. So that so far should not be an issue for travel to the U.S. And we haven't heard about any other countries rejecting a mixed schedule either as far as entry is concerned. But every country is going to make their own rules. So it's not possible for us to predict, all 300 plus sets of rules that might be in place. I have heard that some of the cruise companies are not recognizing a mixed schedule. Again, individual companies might have different rules that may or may not be consistent with evidence. And so, the most that we can do is ensure that we have offered a safe and an effective vaccine to Manitobans to protect them from the virus. We can't change our rollout to try to match the requirements of the thousands upon thousands of different companies and the rules that they may have in place. That doesn't minimize how frustrating it is for someone who may not be able to go on a cruise with their cruise line of choice. Certainly that would be frustrating, but our goal is to protect the health and wellness of Manitobans, and we have to put that first and foremost. And then we are working with the federal government, and they are working with the World Health Organization and other countries to try to have, as much as possible, consistent processes for travel, for border crossings in the future. But certainly that work is ongoing, and we don't yet know where that will end up, if we'll be able to have a consistent process, or if there will be every country creating their own rules.
Thank you. This concludes today's media briefing.